Hi, my name is Rachel. I'm a student nurse. I'm going to be doing an assessment on your newborn baby. Can you verify your name and date of birth against your child's? Perfect. Wash my hands, put on clean gloves.
Okay, so first you're going to assess the eyes. If the baby's eyes are not open, don't pry them open. You're also going to assess the nose. Flaring is not a good sign, so monitor for that. And you're going to check the mouth and the skin color. Next, you're going to place the stethoscope under the blanket and check heart rate and respirations for 1 full minute. This is because of variability, which is normal for a newborn, but you just need to listen for a full minute. So now you're going to take the hat off. You're going to assess for hair distribution, and then you're going to check the fontanelles. So the anterior is diamond shape and the posterior is triangle shape. You're going to assess for any bulging, which could mean increased cranial pressure, and then intracranial pressure, or if it's depressed, could mean dehydration. Next, you're going to check the ears. You're going to make sure that they line up with the eyes. And then you're also going to check for recoil. If something is wrong with the ears, this could mean that something's wrong with the kidneys. So next you're going to check the patency of the nose. You're going to put 1 finger per one side and occlude it, and just to check if the patient or if the baby has an NG tube, you're not going to assess that. Next, you're going to put your finger in the baby's mouth and check for the hard palate and the soft palate, and make sure that a sucking reflex is present. Next, you're going to stroke the cheek and check for a rooting reflex. This is where the baby will turn the head and open the mouth on the side of the cheek that you stroked. Next, you're going to check the neck for any webbing. And then you're going to open the blanket. And then you're going to run your fingers along the clavicle. And you're going to check for any fracturing which could have happened during delivery. Next, you're going to check the brachial pulse. And if you're unable to find it, then check the cap refill on the baby's fingers. And then you're going to check for the simian crease. This is a straight line across that could be present and no other wrinkles on the baby's hand. And this could indicate that the baby could have Down syndrome. And then you're going to check for the palmar reflex. Cool. Palmar grasp, there we go. And then next you're going to assess the baby's, you're going to pull that up and check the baby's nipples. Sometimes they can be inflamed, which is normal. That's due to the mother's hormones. Next, you're going to check the stomach, see if it's rounded, and then check the umbilical cord, if it's clamped, unclamped, any drainage, or if it's starting to heal, depending on what stage the baby's at. Then you're going to assess the lung sounds in all 6 areas. You're going to obviously use a NICU stethoscope or a baby stethoscope. And then you're going to assess the bowel sounds in all 4 quadrants. And then you're going to check the baby's legs. Make sure the baby is warm during it. And you're going to check to make sure that the creases are symmetrical. And then you're going to check Barlow and Ortolani, which is to check for hip dysplasia. You're going to bring the knees up to the baby's stomach and then round it off to make sure that no popping is present. Then you're going to check the Babinski reflex, which is when you stroke your finger along, the toe should flare out. And then
The grasp.
the
Plantar grasp.
And then you're going to check the plantar grasp as well while you're down there. And then you're going to stabilize the baby's head and turn it to its side. And then you're going to check the posterior lung sounds. And then after that, you're going to check the spinal cord and run your fingers down it. And you're going to look at the base of the spine, make sure that there's no tuft of hair or dimpling, because this can indicate spina bifida. And then you're going to turn the baby back over and open up the diaper. So this is a girl, so you're gonna check for the labia majora and make sure that it is covering the minora and the clitoris. And in a male baby, you would check to make sure that the urethra is at the tip of the penis, and then you would feel the testicles individually. So everything looks normal, and then you're just gonna check the patency of the anus. If the baby has pooped, that indicates that the anus is patent. And then you're going to change the diaper if it's dirty, and that concludes our newborn physical assessment.